Can you have a personality disorder and not even know it? According to research, the answer is yes. No matter your age, gender, or race, OCD, obsessive compulsive disorder, can affect anyone. According to authors Hyman and Pedrick, obsessive compulsive disorder is an anxiety disorder with recurring unwanted thoughts, obsessions, and compulsions, which is repeated behavior. Also, according to the National Institute of Mental Health, when the sufferers perform these rituals, they seem to be at peace. However, when they are not performing these, it brings intense anxiety. Sylvia and Rockman reports that it disturbs their everyday living, and that seems to be the biggest problem. I would like to identify some symptoms. Some hand washers constantly wash their hands over and over because they feel that the germs have contaminated their hands. So sometimes they may wash their hands so much that their skin turns raw. Next, we have orderers. These individuals like to have all their objects lined up just right properly. And if one object is out of place, then it brings intense distress. Also, I want to talk about reassurers. The reassurers will constantly go to the door to make sure it's locked, even though they have done it over and over. Sometimes this is done by going to the stove, making sure that it's off. This repeated behavior. Next, I would like to talk about what happens if it's untreated. If OCD is untreated, Penziel reports that it can lead to major depression, and it can also lead to anorexia and bulimia, which is both two eating disorders. Also, Menzies and Rockman report that it can lead to major depression and alcohol and drug abuse. Also, Penziel points out that many of these individuals will be isolated and keep this to themselves for fear of being called loony or crazy. There is help for this. According to Menzies and DeSilvia, treatment is not curable, but it is treatable. Now I would like to talk to you about some ways of treatment. Two ways they do treatment is with antidepressant meds. These meds seem to help with their nerves, regulate their mood, and also with their brain cells, regulating their mind. Also, they use behavior therapy. With this therapy, it helps the patient to think more logically and also to be more responsible for their behavior. Ways to seek out treatment is to call your medical schools and ask for psychology. And when you call the psychology department, you can ask them if they have an OCD clinic available. I wanted to inform you about this disorder because it does have a name. I wanted to let you know that you are not alone. You are able to seek help. So if you or your loved one or someone you know suffer from this disorder, please remember you are not alone and you are able to seek help because help is available.